So Oscar sells health insurance to individuals, not through employers, and you're up against some pretty big competition. United, Aetna. The conventional wisdom in this business is that you need scale to succeed. So what made you see a hole for Oscar?
Yeah. I think, as with many hopefully good businesses, it starts with a very personal experience. In my case, I've had 2 kids the past 3 years. Actually, my wife had the kids. She did all the hard work. I was just there for the adventure. When you have kids, you start really utilizing the healthcare system in a big way. You start looking for a good pediatrician, for the right OBGYN throughout the birth, for the understanding of what the cost will be throughout the pregnancy, throughout the birth, and things like that. And when we first went through this in early 2012, I kind of realized healthcare is insanely confusing, as many people have realized who ever had a health event happen to them. And so, to me, what was interesting really in that experience was that the insurance company theoretically is in a space where, on a spot where it knows so much about you and about the healthcare system it operates, that should help connect those dots in a much better way for you. Should be able to tell you what something will cost you. It should be able to tell you something about the quality or the cost of certain physicians and hospitals and so on. And it very rarely does that. In fact, in my view, it's confused things more than it even helped things. My favorite subject there always is the so-called explanation of benefits, which is this letter you get in the mail
right.
with lots of very high dollar figures on it that then says in a big letter at the top, this is not a bill.
Right.
Okay,
right.
It looks very much like a bill. So it just felt like a very confusing experience. We said, if we can do 2 things, create a product that people really like in this market, that simplifies things, guides you through the experience, gives you convenient access to physicians and hospitals and so on. And then if we can pitch that product directly to individuals, we have a shot against the big incumbents that are sitting on distribution networks that are largely focused on HR departments, brokers, and so on. And that's what then happens with the Affordable Care Act.
And it's open enrollment right now, and you're in New York. You started in New York and New Jersey, but you're expanding to a couple new markets?
Right, yes. We started selling 4 weeks ago in Dallas, San Antonio in Texas, and then in Los Angeles in California as well.